My 8-year-old and my 3-year-old have both been diagnosed with epilepsy. They don't have the violent seizures, but sometimes they just get a blank stare, almost like they're daydreaming, but they don't remember anything afterwards. I've done a lot of research online, and I heard about this new treatment called VNS. Do you think this could possibly help my daughters?
We have Janice in our audience, along with neurologist Dr. Marie Atkinson from DMC Harper University Hospital in Detroit, Michigan. And I want to thank both of you all for being here. So, Dr. Atkinson, let's talk about vagal nerve stimulators, how they work, first of all.
Well, basically, a vagal nerve stimulator is a device used to try to stop seizures in folks that have very hard, resistant to control epilepsy. And there is some animation. I can show you how it works.
That'd be great.
This is the device that's actually implanted in the chest wall of the patient and the wire that's connected. So that's the device that sends an electrical signal through the wire to stimulate the vagus nerve. The vagus nerve has connections with the brain. This is the device that I actually use to program it. And basically what it does is the device sends intermittently throughout the day a pulsed electrical signal to the vagus nerve to stimulate it to try to stop seizures. It can prevent seizures from even coming on, and for folks who are actually actively having a seizure, it can make the seizure less severe or shorter in duration.
Does the magnet really work? Because apparently there's a magnet that the patient can place on the device if they feel a seizure coming on, which a lot of people you don't know if a seizure is going to come on or not.
So this is what the magnet looks like. You actually are given 2 of these when you get the vagal nerve stimulator placed. And for a lot of folks, they do actually feel their seizures coming on. They have like a warning before the seizure comes on. In addition to that, some folks who have really bad epilepsy, they're being taken care of by other family members. So if they see them having a seizure, they can take the magnet, place it against the generator that lies in their chest. Actually, it's on this side. Place it there, and it actually activates the magnet to give an additional pulse of electrical stimulation to the vagus nerve. Almost like what you would use in the ER with a dose of Ativan to stop the seizures, you give it an extra dose of electrical signal. And it's been shown, sometimes it stops the seizure right there, then and there in its tracks, but other times, if it doesn't stop it, it'll make the seizure really shorter, less severe. And it kind of gives the patient who didn't have a choice, a chance to fight their seizures themselves. Now they have an option. I can, do something about my seizures that I couldn't do before.
Now, this answer may be similar to Jim's, but basically, how about with pregnant women? Has it been tried yet or not?
There have been 2 women that I know of in studies that actually had, they had epilepsy, they got pregnant, and they had really bad epilepsy where they already had a vagal nerve stimulator before they were pregnant. It didn't show any ill effects to their children or to their fetus.
This is such another great option, another great possibility, and we actually have Elise on Polycom with us. She's had the VNS device for over a year, and Elise, I know you're just one person, but how has it worked for you?
Well, I always say that everyone's epilepsy is very different, and my doctors, of course, reiterate that, but it's worked very well. I've seen about a 60 to 65% reduction in my seizures. It's really, frankly, improved my quality of life. I mean, I'm a wife and a mother of a very active 4.5-year-old little girl, and I think that my husband and my mom feel, much more confident in me spending time alone with Hayden, our daughter, just because the VNS is working so well. It works, it really does.
Well, thank you for sharing your story with us. And Janice, hopefully you got some answers today. And Dr. Atkinson, thank you so very much for joining us and explaining this to us. We appreciate it.